BSI, I'm looking at the scene, it looks safe. There's one patient who looks conscious but on the ground. I don't know what exactly happened. That was my general impression. I'm going to go ahead and call 911 just in case. I'm going to approach the patient and I'm going to ask, "Hey sir, my name is Marissa. I'm in EMR. Is it okay if I help you out today?"
Yes.
What happened?
I fell
You fell doing what?
riding my bike.
Okay, sounds good. Well, I'm gonna go ahead and check your airway, but first, before I do that, I'm gonna consider stabilizing C-spine. So I'll come around here and just open up your mouth for me. Okay, airway looks clear. I'm gonna check your breathing. Take one deep breath. Okay, unlabored. So now I'm gonna go ahead and take your pulse. Right, there's a pulse. So I'm going to, the second rescuer is holding C-spine, so we're going to gently remove the hat. There we go. And I'm going to check for bleeding from your scalp to your toes. I'm going to check behind the neck. Your face looks okay. Shoulders, clavicle. I'm going to expose the chest and check for bleeding. I'm going to expose the stomach and do the 4 quadrants of the stomach. I'm going to check the back, all the vertebrae. No bleeding there. Verbalized genital area. Check the pelvis for bleeding. Get behind the legs. No bleeding there. Checking the cuffs of the pants. I take off the socks. Around his foot side to switch. Take off his sock on this side. Check this pant leg. Under the legs. No bleeding there. I'm going to go ahead and do his arms. No bleeding there. In his shirt cuffs, no bleeding there. Walk around his foot side to his other arm. Check in the cuff. That seems fine. So then I'm going to go ahead and do a full physical assessment. So I'm going to start with your head, and I'm going to look for deformities, open wounds, tenderness, and swelling. So I'll check with the scalp. That looks fine. I don't feel any broken bones. I'm going to look in the ears and nose for CSF. I'm going to check the facial bones for any fractures. And if you'll open your eyes, I'm going to check pupils. Track the pupils. Good. I'm going to check your breath, breathe on me for a fruity smell. I'm going to check the cervical vertebrae, each one. I'm going to look at the neck for an inline trachea and jugular distension. That looks fine. I'm going to check the shoulders and clavicle. I'm going to check the sternum to make sure it's intact. going to check and expose the 4 quadrants of the stomach. That seems intact. I'm going to go ahead and check the pelvis. I'm going to separate it, and then push it in. There's no tenderness there, so that's good. I'm going to go ahead and check the arms, and I'm palpating for any broken bones. I'm going to check circulations, papillary refill. That looks good. What am I doing?
Touching my hand. Rubbing my hand.
What am I doing?
Pinching my hand.
Good. And then I'm going to go around to the other side. Do the other arm. Papillary refill. That looks good. What am I doing?
Rubbing my hand.
What am I doing?
Pinching my hand.
Good. Okay, I'm going to verbalize genitals. Then I'm going to go and palpate the legs. Make sure to get under the legs too. That looks good. I'm going to take off the socks and check papillary refill on the toes. What am I doing?
Rubbing my foot.
What?
Tickling my foot.
Okay, I'm going to walk around the other side. Make sure to get under the legs. What am I doing?
Pinching my foot. Tickling.
Okay, and now I'm gonna ask that you push against my feet.
Your hands.
Yes. And then, yep. And I'm gonna do the same with the arms, the hands. Give me both hands. Can you squeeze? Can you wiggle your fingers? Okay, great. Now let me just check if I got everything. Now I'm going to check the back, the vertebrae. So I'm going to bend this leg. Put this arm this way, above your head. Right here. Second rescuer is going to be stabilizing C-spine. So I'll just take this. Actually, no, just kidding. It's the other way. This way. Roll over here. And I'll cross this way. And I'll expose the back and check each vertebrae. That looks good. I'll check the back of the legs again. That seems good. And then I'll roll him back over on the count of 3 of the rescuer holding C-spine. 1, 2, 3. Back over. And then that is the end of the physical assessment. And then I am going to do the medical assessment since he is conscious. So what are your signs and symptoms today?
My head hurts.
Okay, sounds good. Do you have any allergies?
Yes.
What are your allergies?
Cats.
Are you on any medications, prescription, or recreational drugs?
No.
Okay. Do you have any past medical history?
No.
Okay. What was your last intake, fluid or solid?
10 minutes ago.
Okay, when was the last time you used the restroom?
9 minutes ago.
Alright, so what events led to this injury?
I was walking and I fell.
Okay, sounds good. Now the onset of your signs and symptoms, was it gradual or sudden?
Sudden.
Does this position provoke the pain at all?
No.
Or does it make it better? Okay. So what is the quality of your pain? Is it sharp? Is it dull?
Yes.
Which one?
Sharp.
Does your pain radiate anywhere?
My head.
Okay. Now the pain on a severity scale of 1 to 10, what would you rate it as?
8.
Okay, do you know what time approximately the accident happened?
Morning.
Okay, morning. So now I'm going to just take your baseline vitals. So what is your name?
Sam.
Where are you?
Missoula.
What estimated time is it right now?
1:30.
And what event are we at? What am I doing?
Helping me.
Okay. I'm gonna check your heart rate. So I'll take your heart rate right here for 1 minute. Okay, I took it for 30 seconds and I times it by 2. That's normal. Your respiratory rate, I'm just going to feel here and count your breaths for 10 seconds. Okay, your respiratory rate's pretty high. I'm going to look at your skin. Your skin seems pretty warm and dry, so that's good. Your estimated blood pressure, since I took it on your radial point, is going to be 80. And I'm going to look at your pupils. Okay, your pupils are equal, round, and reactive to light. And now I'm going to keep monitoring his vitals. I'm going to treat for shock if necessary. I'm going to treat injury appropriately and wait for paramedics to